Gonorrhea is an infection of the mucous membrane surfaces caused by Neisseria gonorrhoeae. Neisseria gonorrhoeae is known as gonococci or gonococcus and is a species of gram-negative coffee bean-shaped bacteria, first described by Albert Neisser. Gonorrhea is an infection caused by a sexually transmitted bacteria, which infects both male and female. It infects the urethra, the rectum, the throat, and in females, the cervix. It is spread through unprotected sex, and babies can get infected if the mother is infected through childbirth. Gonorrhea in many cases have no symptoms, so you may not even know that you are infected. So let's find out more about gonorrhea. Gonorrhea is a sexually transmitted disease that can infect both men and women. This can infect the genitals, rectum, and throat. One can get the infection through vaginal or oral sex with someone who has the infection. It is second only to chlamydia in a number of cases reported to CDC. Incidence remains high in some groups defined by geography, age, race and ethnicity, and sexual risk behavior. The proportions of gonococcal infections caused by resistant organisms is increasing. The rate of gonorrhea declined by 74% from 1975 to 1997 after implementation of a national gonorrhea control program in the mid-1970s. After the decline halted for several years, in 2009, the gonorrhea rate decreased further to 98.1 cases per 100,000 population. This was the lowest rate since recording of gonorrhea rates began. The rate increased slightly in 2010 to 100.2 and increased again in 2011 to 104.2 per 100,000 population.
Gonorrhea is transmitted through sexual contact from male to female via semen and female vagina to male urethra. Rectal intercourse transmission rates have not been qualified, but rectal intercourse appears to be an efficient mode of transmission. Perinatal transmission from mother to an infant can occur during vaginal delivery. Gonorrhea is associated with increased susceptibility to and transmission of HIV infection. This is thought due to increased HIV shedding in individuals with gonococcal infections.
Gonorrhea is caused by Neisseria gonorrhoeae, which is a gram-negative intracellular diplococci, which also divides by binary fission every 20 to 30 minutes. Neisseria gonorrhoeae attaches to different types of mucus-secreting epithelial cells via a number of structures located on the surface of gonococci. Neisseria gonorrhoeae has the ability to alter these surface structures, which helps the organism invade an effective host response. Gonorrhea employs several mechanisms to disarm the complement system, which may result in a survival advantage in the human host.
Neisseria gonorrhoeae causes several clinical syndromes, including urogenital, pharyngeal, and rectal infections in males and females, and conjunctivitis in adults and neonates. If untreated, gonorrhea can cause of pelvic inflammatory disease, tubal infertility, ectopic pregnancy, and chronic pelvic pain.
Symptoms for men: a burning sensation while urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles, urethritis, and or epididymitis. Symptoms for women: most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk of developing serious complications from the infection, even if they don't have any symptoms. Some symptoms you would find would be painful or burning sensation while urinating, increased vaginal discharge, and or vaginal bleeding between periods. Rectal infection symptoms, if any, would be anal itching, discharge, soreness, bleeding, and painful bowel movement.
Treatment for uncomplicated gonococcal infection of the cervix, urethra, and rectum must be treated with antibiotics. Ceftriaxone 250 mg plus azithromycin 1 gram or doxycycline 100 mg. If ceftriaxone is not available, cefiximine could be used instead. Those who are infected with Neisseria gonorrhoeae should be treated with recommended cephalosporin-based combination therapy. Gonorrhea prevention. Gonorrhea can be prevented by screening, having safe sex by using condom, partner management by limiting the number of sexual partners, or not having sex by reporting, and patient counseling and education where the nature of the disease and how the disease transmits discussed, so you could reduce the risk of being infected. Gonorrhea is a sexually transmitted disease caused by the agent Neisseria gonorrhoeae. It is mostly prevalent among the young adults between the age 20 and 24. It is also mostly asymptomatic, which means that someone who has the infection may not show any symptoms, so that it is important that you get tested if you are sexually active. Vaginal bleeding, discharge, swollen testicles, and even burning sensation while urinating are some of the common symptoms of gonorrhea. Even, even a pregnant woman who has the infection can carry or transfer the STI to the newborn during childbirth, which may result in many complications. Antibiotic resistance plays a strong role in gonorrhea, which means that it cannot be cured with normal drugs. That's why prevention is better than cure. Having safe sex by using condoms, limiting the number of sexual partners could always help you reduce the risk of getting the infection. And always remember, it is always better to be safer than being sorry.